My name is Stephanie Dillon. I am in Section 4 and today I'm going to be demonstrating a IV insertion. I have orders here for my patient to get an IV insertion of a 20 gauge needle for our IV meds and fluids. So right now I'm going to prep my extension cord. I'm going to draw out 3 milliliters of normal saline. I'm going to attach that to my extension tubing. I'm going to prime it as well. Okay. I'm going to put that back in its packaging. So now that I have that prepped, I'm going to gather my supplies and go into the patient room. Hello, my name is Stephanie. I'm your nurse today, and I also have new orders today to put in an IV for meds and fluids. So right now I'm going to check your name badge. Can you tell me your name and your date of birth, please? Okay, thank you. Alright, and is this your non-dominant hand or arm? Okay, that's good. Have you had any mastectomies, fistulas, stunts, or past procedures that we should know about before we do anything with your arm? No? Okay, that's good. So now I'm going to select a vein, one that's bouncy and resilient. So that'll be my insertion site there. I'm going to do some hand hygiene and put on my gloves. Alright. Now I'm going to apply a tourniquet 4 to 6 inches above the venipuncture site. I'm going to prep it so that I can pull it out with one little pull later. Okay. Now I'm going to get an alcohol wipe and clean the insertion site in circular motions. I'm going to work my way out. Alright, now that I have that done, I'm going to get my IV needle. Take off its top. Okay. I'm going to pull the skin taut and in the opposite direction of the venipuncture. Alright, you're going to feel a big stick, okay? Alright. Alright, and once I inserted the IV, I observe for flashback, and then I advance a 1/4 inch further, and then I'm going to advance the hub of the IV until it is flush with the skin. Okay. And now I'm going to pop the tourniquet and apply pressure. I'm going to take the stylet out. I'm going to get my extension tubing, and I'm going to attach it to the insertion site, the port. Okay. And now I'm going to aspirate and check for blood. Okay. And now I'm going to flush. Alright. At the same time, I'm going to clamp the port. It's difficult to do with one hand without pulling out the catheter. Okay. Okay, now I'm going to take out the saline and I'm going to apply the Tegaderm. Okay. gonna make this work. Okay. Okay. Yeah. Okay. I'm gonna take one end and date, initial, and put the size of the gauge, and as well as put the time. I'm gonna put that at the edge of the dressing. And now I'm going to take down the insertion site. Okay, need all that. Okay, tape it down. Oh, what is that? Prep tape. Okay, take that down there. Alright, now I'm going to throw all of my sharps into the sharps container. That's the sharps. And now I'm going to document the time, the date, the gauge, and how the patient tolerated this, this IV insertion. I'm also going to document the number of attempts made. And then I'm also going to, before I leave the room, I'm going to make sure the patient is comfortable, make sure they're in a comfortable position, make sure that if they need to go to the restroom, put their personal belongings close to them, and assess their pain. It looks like they tolerated it well, so I'm just going to take my stuff and go. And I'm done.